Good afternoon, everyone. Thank you for joining our Wellbeing Webisode today. We're going to go ahead and get started. Just a few housekeeping items. You are all on mute currently, but if you have any questions, we encourage you to enter them into the Q&A chat, and I will answer them at the end, or if they relate to the topic, we will answer the questions throughout today's conversation. But hello again, and welcome to our Wellbeing Webisode, Injury Prevention, Management, and Recovery. I am Kelly, a health service specialist at Geisinger, and with me today is Kerri McHale. Kerri is a Northeast Regional Therapy Manager at Geisinger. She has a bachelor's degree in business and a master's degree in physical therapy. Today we're going to discuss common causes of exercise-related injuries, steps we can take to prevent injuries during physical activity, and how to safely manage injuries and return to exercise following an injury. I'd just like to note here a disclaimer that all of the information today is being provided to increase your awareness. It is not intended to be medical advice. If you believe you have a medical condition or an injury or have specific questions regarding your health, please see your physician. Welcome, Kerri, and thank you for joining us.
Oh, thank you for having me. And I just wanted to add to that a little bit. I have a lot of experience. I worked for many years in an outpatient clinic that I saw a lot of sports injuries, and I'm also a Pilates certified reformer instructor, and I'm also a CrossFit instructor. So definitely have some experience outside of just the inpatient realm, just in case, anybody was wondering qualifications for, discussing injury related activities and prevention.
Yeah, sounds like you have a lot of experience and are no stranger to injuries.
Yeah.
So we've talked in several of our webisodes before about how regular exercise is very important for our health. But like with any sport or type of activity, there's always a chance you can get hurt even while exercising. How common are exercise-related injuries, and are there certain groups of people who are at greater risk of experiencing an injury?
So injuries can happen anytime to anyone, really doing anything. So, you could go out and trip over a curb and become injured, right? So no one is immune to the potential for injury, but we don't want to think of that as a reason to not exercise because there are countless health benefits that exercise offers us. I would say in terms of the highest potential for injury can be in maybe perhaps those beginning an exercise program without, good coaching or good sort of instruction on what they're doing. Those that don't perhaps give attention to proper form. For example, if you're starting to use weights, you want to make sure that you're really using good form before you just kind of heave ho big weights. And there's many examples of that. And those that have perhaps the risk of overtraining without incorporating rest days, or have the risk of overusing certain muscle groups by repeating the same movements over and over without incorporating any kind of variety in their exercise routine and or mobility activities.
So I would almost summarize it that, exercise injuries are pretty common and you can really happen, to anyone regardless of, their experience level, regardless of what they're doing, maybe like you said, even just walking, you can get injured.
Well, now that one's a risky one because I really would not say that walking is risky in terms of injury potential, unless, of course, you're walking in an area that perhaps has rough terrain. And then, of course, you'd want to make sure you have proper footwear. But generally speaking, walking is one of the best, most underrated activities for not only weight loss, if that's a goal of yours, but overall health and wellness. We definitely evolved to walk great distances, and one big risk of chronic injury is that we sit entirely too much as a society, and that is definitely a growing problem. In terms of types of injuries that occur commonly, I mean, I would say that's highly dependent upon the individual and whatever types of sports or exercise they're performing. As I was saying earlier, those who attempt lifting weights for the first time but don't really investigate how to do it properly or the correct form that needs to be used may be, say, more at risk for back injuries. And maybe those that are training for a marathon or just running daily, not doing anything else, they're just running every day, they might be more prone to chronic overuse injuries like, maybe bursitis or tendonitis. Or that maybe that you have those that participate in sports that require a lot of agility and strength, like tennis or martial arts. And those people may be more prone to twisting or tearing type of injuries, like, meniscal tears or Achilles ruptures, things like that. So it's definitely individual depend. It also depends too on former injuries. Do you have a injury that something that you injured years ago that, perhaps a specific sport or activity might be more prone to flare that up. So it is definitely highly individualized, but walking is almost always a safe bet in terms of exercise. So when in doubt, walk, walk, walk. It's the cure for almost everything that can ail you.
Yes, gotcha. Yeah, so it sounds like there's a lot of variables, a lot of different injuries that you may experience depending on what you're doing, what your history is, and
Hmm.
so on.
Yeah.
So why do injuries occur? I'm guessing there are probably some common themes. I know you've mentioned like, not in a good form. So what would you say? Are there some common causes of exercise related injuries that we can identify, and what are they?
So I definitely I sort of touched on some of that above. But I would say, you know, in addition to poor form, possibly poor footwear, and overtraining, the risk of overtraining. Undertraining and overtraining are two problems, right? We often see kind of two extremes: athletes who may push through pain, which is not always good. Pain can be the body's way of indicating that there is a problem which needs to be dealt with. Um, and then we have the other extreme with that maybe those that feel a bit of discomfort and then just decide that exercise is no good. I'm going to stop. I'm not going to do anything because I'm afraid I'm going to get hurt. And that is another extreme we don't want to see. The best thing to do if you suspect an injury or have a recurring injury is to first modify your activity level. It doesn't mean that we have to completely stop. I think that's an often a misconception as a therapist that treated many outpatient injuries. I had many, many people say, well, like I kind of felt something and then I just stopped doing everything, even walking. And that's never going to be really good. Movement is medicine. So the cure for most things is not less movement. It's perhaps modification of whatever movement you were doing that may have caused it. It may mean backing off a certain activity for a while. But the worst thing you could do is just sit and lay down. We, want to keep our body moving in some way every single day.
I find that really interesting that we're all so quick to jump to the extremes of pushing through
Yes.
pain
Yep.
or the other extreme of, like you mentioned, not doing anything. It sounds
Right.
like we need to find that middle ground
Right.
almost.
Moderation, right? That's what we
Yes.
preach for a lot of things, and this is the same.
Yeah, diet. I'm a dietitian, so it's moderation is the key for exercise too. So,
Right. Correct.
so what about prevention? Would you say that most exercise related injuries are preventable?
So I mean, I don't know that a blanket statement like that can be made. Certainly there are some things that we can do to give ourselves the best chance, but even the best athletes get injured from time to time, and it isn't necessarily anyone or anything's fault in the sense that one person might do the exact same thing and not get injured, and another person, due to their history or the way their body is made, does get injured. So that's a tough one to just kind of say they're all preventable. But I think the best chance of preventing injury is, again, keep your body moving daily, with lots of walking and out of chair, out of bed, definitely out of bed, but even out of chair activities. Incorporate, just as a general rule, incorporating some sort of resistance training a few times a week, and also keeping the joints flexible, keeping the joints as mobile as possible, keeping from getting, too stiff or any kind of muscle shortening happening. That's also very, very important, as part of the weekly routine, as part of anyone's weekly routine.
Gotcha. So during my research for today's conversation, I noticed that a lot of people mention that incorporating a proper warm up and cool down is a good way to prevent an injury. Can you tell us a little bit more about the importance of including a warm up and cool down and give us some guidelines on what an effective warm up or cool down should consist of?
Yeah, I mean, so warm-ups and cool downs are a good way of preparing your body, warm-ups in general for preparing your body for activity, and cool downs for, sort of bringing yourself back to homeostasis, pretty much. So warm-ups, help raise the heart rate gradually, and it also helps and is always good to prepare the muscles for what you're going to be asking of them, by performing some lightweight, sort of low rep movements, similar to whatever it is that you're going to be doing them in whatever exercise you have planned for that day. But, just in general, even just often taking a few trips up and down your stairs, just walking, up and down the stairs a few times if you're doing something like right from home, marching in place for 3 to 5 minutes, or, throwing some kind of little air squats in, for a few minutes can be good enough. Really, 3 to 5 minutes of just sort of movement, is a good place to start. For cool down, just taking a few minutes to lower your heart rate by slowing down whatever activity you were doing for a few minutes when it's over. So, if you went for a run, taking 3 to 5 minutes and, slowing it down to a walk to sort of bring your heart rate down, kind of let your muscles regroup, things like that. One thing people often do think as part of their warm up they should do is stretch. And generally speaking, that's not really the best thing to do, because, you want to warm the muscle up before you stretch it. So just like anything else, if we don't expect our cars to run on a stone cold engine in the winter, right? So our muscles really aren't primed for a stretch when they're cold. And what I mean by cold is, if you've been sitting, for in your car or whatever, and you're getting out, you should not just immediately stretch that muscle. You should walk around a little bit, get it moving a little bit. Like I said, marching in place, a little light jog, something like that. And then you can ask of it a little stretch, start light, and then progress that a little bit. I think we may talk about stretching in a little bit, but yeah, you don't really want to stretch a cold muscle. You want it to be warmed up. So often after a cool down is a great time to really get sort of a really nice stretch in, where you can really impact the mobility at a joint, because the muscle's going to be really warmed up.
Yeah. I think that's often, a controversial topic around exercise is when to stretch.
Yeah.
So I think that is really a great example of, the car in the winter and the danger, the not
Yep.
so great benefits of stretching when you're cold.
When it's cold, exactly. Yep.
Um, so are there any, certain types so we already covered that, we should be stretching, saving it, till we're warm, maybe as part of the cool down. But what about types? Are there certain types of stretching we should be doing?
Again, we want to be careful about, trying to, put some sort of bucket, everyone should do this, because, it's it's as individualized as we are all different and have different types of jobs. Some people have more sedentary jobs. Some people have jobs with a lot of movement. Look at the difference between, someone who sits at a desk all day and somebody who, does, garbage collection, how much movement, how much difference there is in the movements of those two jobs, right? So we have to think about what we do all day, what our requirements are of our activities of daily living are. We also have different genetics, different injury histories. So there's not really one specific set of stretches for all people. Also going to depend on what activity you want to do. But that said, keeping all joints mobile and addressing your own individual issues is always going to be a good idea. And as we said, really we only want to do it when the muscle is already warm. So generally after exercise is really the best times, or at least after a nice 5-minute warm up. There are all kinds of stretching exercises, and which is best truly is going to depend, more on the type of activity you have just done, or perhaps any areas of chronic problems you might have. Some people might have to give more attention to their knees or hips, while someone else may have to give more attention to their shoulders if they're a swimmer or, anything like that. But often or when in doubt, a physical therapist or sometimes, even a personal trainer can really help you establish the stretches that might be best for you personally. And that is always going to be a good avenue if you are, want to undertake an exercise program of any kind and want to address your own individual issues or, potential for injury or anything else, having a qualified expert sort of look at you and say, hey, you've had back trouble before, or hey, these muscles in your front are pretty mobile, but the ones, back here are not. So you're going to want to give them a little more attention. That's really always going to be, because really it's so individual.
Yeah, I think that's such a great message and takeaway for us today is a lot of what we're discussing is individualized, and it's really
Yeah.
hard to, what may be important and work for me might look totally different than
Exactly.
somebody
And
else.
yet not a reason not to do it, right? Because I mean, the benefits of exercise and activity are off the charts. The benefits just far outweigh any risk factors. So I think my big message in this is to encourage people to, you know, when in doubt, seek out the answers to these questions, but don't use please don't use the fear of injury or re-injure anything to make you not doing these things, because the exercise benefits our metabolic health, lowers our risk of all cause mortality, and it just the benefits, I can't say enough. So, paying attention to your chance for injury, and that's definitely valid. And we certainly don't want people to get injured, but we also want to stress the importance of establishing and continuing with an exercise program.
Gotcha. Yeah. Yeah, we could have kept you talking for, the whole session on the benefits of exercise,
Yes,
I'm
for
sure.
sure. Yes.
So I think one common phrase we hear often in the sports arena exercise is no pain, no gain. What are your thoughts on this? Is there validity to that philosophy?
Um, I think so. That's a loaded question, right? Because I think there is some validity in the sense that we do need to do hard things to see progress. Um, Oftentimes people quit, because something feels hard, when in reality, we were meant to do hard things. Pain is definitely defined differently by many people. And, it's important to remember that, your brain is always going to try to get you to stop doing uncomfortable activity long before our muscle actually really needs to stop, right? How many times have we thought about or, taken part in a difficult exercise class or a run or whatever, and we're a quarter of the way through it and we're like, oh, this is terrible, I want to stop, or whatever thoughts that we have. And that's really your brain, which is designed to seek comfort more on an evolutionary level to keep us alive and save our energy for a time where we may need it more, like to run to find food or from an animal. That's how we evolved. Our primitive brains don't really understand exercise the way we have come to know it. There was never, when we were evolving, a time where people, quote unquote, went out to exercise. It just didn't happen. That was your day. Um, at one time, most of our day was spent in some sort of activity, foraging for food, finding food, all of those things. So even sitting was an active process at that time, since we did not have, comfortable chairs to sink into. So, even sitting was more like squatting at that time, where, your trunk was active, your legs were an active part of it. So, things are quite different now, obviously, in many good ways, but also in terms of our bodies and activity levels, some not so good ways. And that's important because it's a real precursor to why injuries happen so frequently now. We're just too comfortable too often, and our bodies are not ever getting the ability to strengthen at the ligaments and the muscular connections and things, because we're letting them rest so often. They're really just losing strength, and we were not designed for that. So we were built to do and sustain hard things, but we've just stopped doing them the more comfortable our external environment has become. But we don't live in those times anymore. And so a lot, I think, when we feel like stopping an activity because we feel discomfort, either in the form of feeling out of breath or tired, when in fact we may need to push through to get stronger or gain some of that cardiovascular endurance. So, but I think there is a difference between that and true physical pain, which I think most of us can pretty easily identify. But true physical pain that doesn't go away, after some rest, should be taken more seriously, and seriously enough to modify activity levels. And of course, if it becomes problematic, and, one has difficulty performing their activities of daily living for, a reasonable period of time, I think, definitely seeking medical attention to prevent a worsening condition is important.
Yeah, it's funny that you you said that about your mind telling us to stop before, really our body needs to. I just heard that from an instructor on a Peloton class that I
Yep.
took. And
Yeah, that's a good example, because that's, you probably are thinking about stopping, and, you really don't physically need to stop usually.
yeah, so definitely good to hear that message twice
Yeah,
in 48 hours. So
there you go.
but like you also mentioned, discerning between, physical injury and pain is important too.
Right.
So we've talked about warm-ups, cool down, stretching, for prevention. Anything else? Any other steps that we can take to do our best to stay injury free?
Um, you know, Basically just, as I had said, moving more regularly, sitting less often, incorporating more strengthening and mobility, and making sure you do your homework, on good footwear and form, whether an exercise program is new to you, or even if you think everything there is to know about it. There's always new research and new things that come out, and just making it a point, for a point to stay on top of things, and really listen to the coaches in your chosen, form of exercise. They're the experts as well, and they can often help you keep from getting injured.
I just think, it's really, eye-opening to hear on multiple occasions today that, a way to prevent injuries is to move more. So
Yep.
I hope that message, it's hitting home for me and it hits home for others too.
Yes, I hope so.
So how, muscle soreness after exercise, especially for newcomers, or if you're switching up your routine, if I decided to be a runner or do something different, I would suspect is pretty normal.
Hmm.
But maybe some people find it hard to identify, is this soreness? Did I have an injury? Any advice there on how to identify the difference between soreness and injury?
So, I mean, in general, excuse me, I don't think it's too difficult to discern. I mean, I think most people have experienced some soreness after a new activity. And it's completely normal, and it usually peaks 24 to 48 hours after the activity. So that's called delayed onset muscle soreness. So you're not going to feel that, like you said, if you decided to pick up running and you really didn't gradually have any kind of on-ramping to it. You just went from not running to running 2 miles. You're probably going to be sore the next day. You're not going to be sore that night usually. But, within 24 to 48 hours, you're probably going to feel it in the areas that were um the muscles that were heavily recruited for those activities that, generally you don't generally use. They're going to have been asked, more than their usual. So they're going to get some little bit of what we call micro tears in them. That's not a bad thing, and it's definitely not a reason to quit. You need that delayed onset muscle soreness to actually build muscle tissue, because the little micro tears rebuild themselves. And when they do, they build new muscle tissue on top of it. So it's not a reason to quit. I definitely have had people who get so now the idea is don't take on something so hard so fast. A lot of times when we decide to take on an exercise program, we get all gung ho. We're very excited about it. We approach it like gangbusters, and that's not really the right strategy. Or you're going to get incredibly sore, and then it's counterproductive because you're going to have to take probably the next 3 to 4 days off from that activity because you're not going to be able to tolerate anything. And then, now you've lost 3 or 4 days, or you haven't really done much, when had you approached it gradually and sort of had an on ramping to it, you may not have become, doesn't mean you may not have had any soreness, but it certainly wouldn't have been, where you'd have difficulty standing up. And I've had all of those kind of soreness before. But again, not a reason to quit, needed to build strength. To distinguish from an actual injury, again, depends on the area of the body we're talking about, depends on what you're feeling. A lot of times, injuries, true injuries, can be accompanied by swelling, um, discoloration if something is bruised or something like that, or if you had any kind of tendon sprain or muscle strain, you might see discoloration. Um, and you might even feel pain at rest when you're not even doing anything. That's a little bit more indicative of an actual injury that could need medical attention. With muscle soreness, it's usually only going to be experienced when moving the affected muscle or reattempting the activity, and it's generally when you stop doing that activity. There's you're not feeling it. You're not feeling it just laying or sitting there.
Gotcha. Yeah, that makes sense. And I think it's some good tips to help us, distinguish and, know when we might need to rest or maybe modify, like you mentioned before. So being
Right.
mindful of our time, I think we have time for one more question. So I just want to, we've mentioned that injuries, they do occur. Um, just it's part of the risk. Any standard recommendations on how to treat an injury or how to know when to seek medical care?
Um, you know, uh, So there are, again, it depends on what it is. Different locations for injury will have different modalities that can help. Oftentimes, problems might go away after a few days of rest, or maybe an ice or heat treatment, depending on what it is. But if not, it never hurts to have your doctor check things out, or even an orthopedic urgent care if the pain is really persisting at rest.
Gotcha. Well, thank you, Kerri. Thank you for sharing your plethora of experience, all of the great tips with us today. Thank you to all who
Yes, my
tuned in
pleasure.
to listen. I'm going to wrap up here. If you have a question, feel free to put it in the Q&A. I'm not seeing any at the moment. But if you do have any feedback, any questions that come up, you're welcome to email us at wellness@geisinger.edu, and I'll be sure to get you a response to your question. And be sure to join us next month for our well-being webisode on the power of sleep to improve health.
Thank you.
Thank you all. Stay cool and have a great day.